Okay, so it's 102. It's 102 now, so we're going to get started. I guess this is part of our webinar series, but we're going to call it a mini webinar. And so as everybody knows, on January 1st, there was a requirement for AEDs on construction sites. And what we wanted to do, and thank you very much to Smart Safety, so Steve Heck and Daniel, what we wanted to do is we wanted to create a best practice guide so that members can create their own policies. And so often we're asked, why not just create a policy that everybody could use? The answer to that is you need to take what we're giving you, but you need to take it and you need to apply it to your site because there's on-site factors and there's specific employer factors that you need to consider. So we're not trying to be jerks, we're not trying to be rude. What we're trying to do is make sure that you have the best safety policies that you can have, and we want to provide you assistance in how you do that. And what I'd say is anybody who is on here and needs to create their own policy for this, please reach out to Steve and Daniel at Smart Safety because they can help you go through it. And so we create the guide so that you know what you should put into your policy. But we really can't create one policy for the industry because it has to take into account your very specific employer specific issues as well as your site specific issues. And so I just wanted to get that out front. Big thank yous to all of the different, and we've done more than one AED webinar, so I don't need to get too much into it. But this didn't happen on its own. So big thank you to the Health and Safety Committee. Big thank you to Steve and Daniel for writing this. Thank you to obviously Heathwood, the Mikey Network for all of their leadership, all the construction unions, the Minister of Labor, all of the stuff that we've said before. So again, this is kind of a mini webinar. So you're going to hear from me. These are the opening introductions. We're going to turn it over for a presentation, and then we're going to do questions and answers. And so use the question and answer feature, use the chat or send us a text. We'll get your questions to the experts. And that's it. It's kind of a quick and dirty webinar. We will send out the slide deck afterwards, and we are recording this, so it will go on the website. So all the resources will be there. And again, if you've got questions, call Steve, call Daniel, call me, and we'll get you set up. If you need an AED, I know there was a little bit of a backlog. We do recommend that you go to the Mikey Network. They can help you find one. They can also help you with some of the implementation stuff. If you got questions on any of the WSIB stuff, I think everybody's got my cell phone and my email. So without further ado, let's start the presentation.
Awesome. Andrew, I'll get it kicked off. I want to second the fact that, I've been doing this a long, long time. I've been part of RESCON safety committee for a long time, and it's very few times you get an opportunity as a safety professional to be able to make a difference. And I can tell you over the past few years, managing a number of constructors in the city and in Ontario, we ran into far too many circumstances where we were without an AED, and unfortunately, we lost a lot of workers' lives over the past couple of years, and a couple just this past year. So, inevitably, this is a great step forward in saving workers' lives, and I couldn't be more proud to be part of this group. Yes, this policy process procedure for AEDs has to be specific to the environment to which you're placing the AED, because there's a number of factors that have to be considered. And I'll be the first one to admit that there was a circumstance that we were involved with where we had an AED on site. Things didn't go perfectly, and unfortunately, the individual that was actually on the upper half of the building passed away because we didn't get the AED to that individual on time, and it happened to be after work hours, so that even made it more difficult. So Daniel's going to walk you through the policy and the standards and the things that need to be considered when developing your own policy. And if you have any questions, I look forward to answering anything at the end. So Dan, I'll pass this off to you.
Thank you, Steve. Thank you, Andrew. Thank you, Steve. Thanks for everyone for joining. As gentlemen mentioned before, this guideline was developed to assist the organizations in producing robust AED policy that is specific to your organization as well as your projects. It consists of the 13 major steps that we developed, and through this presentation, we'll go over those 13 steps. And obviously, if you have any questions, feel free to ask them in chat. So without further ado, I'll start with step one. And that usually based is whether AED requirements even apply to us as a company. That's where you want to ask this question. Um, do we act as a constructor on a project at a given time, as per Occupational Health and Safety Act? So reference the definition. Are you acting as a constructor? Next, you want to make sure that requirements that are applicable by Regulation 15725, the one that is enforced as of January 2026, apply to you. Those requirements more specifically are you going to have 20 people or more regularly working on site? And are your project going to go for more than 3 months? If those two requirements apply to you, then AED requirement automatically kicks in. If not, if one or two requirements don't apply to you, technically regulation doesn't apply. Don't dismiss the idea of AED just yet because one or two requirements don't apply, because you still need to consider work-specific risks that will apply to the project. And if substantial factors present, you still want to consider AED while you're making this decision. During your development stages and during your assessment stages, document meeting minutes and any type of assessments that you're doing before you're making decision on AED implementation. Those are evidence of you actually completing assessment and not just skipping that step. Whether you go for it or not, those evidence show that you had this conversation, had this assessment in place, and you acted on it. Step two is actually conducting assessment. So your policy needs to have a provision in it to make sure that your team is equipped with steps to complete detailed hazard and risk assessment before you make a decision whether AED has to be implemented in its own site, right? So you want to assess your worker-specific factors, age group. Right now, demographic changes and shifts. Workforce becomes older. You want to make sure you assess tasks. Are those tasks related to high physical endurance tasks? Is there going to be excessive material handling? Are the workers going to be subjected to extreme weather conditions? What are the shift length? All of those things need to be considered. Additionally, in your policy, you want to make sure that you put provisions for consideration of the site-specific layout. Where the project located? What's the actual layout of the map itself? Do we have multi-phase project? Are there multiple blocks? You also want to make sure that your team estimates approximate time of EMS arrival. Where is the nearest location of EMS? Are we going to have any difficulties with traffic or access? Are there any barriers or constraints related to the project itself, especially due to size? It is strongly recommended to use standardized approach when it comes to risk assessment. All your hazards need to be treated the same, as well as cardiac incident hazards. So use the same format and use the same procedures that you use for other hazards at the project. Make sure that you update your hazard assessment every time conditions change. Due to these factors that we just mentioned, that's why it is very advisable to go through all these processes and make sure you consider all the hazards before you dismiss implementation of AED on site. So even if some of the criteria do not apply to your project related to 15725, you still want to consider your general duty to apply every reasonable precaution under circumstance to protect the worker under the act. Step 3 is usually relates to defining your scope in developing your section for the purpose statement. So purpose statement usually involves listing all the regulations that are applicable to the policy. In your case here, it would be a regulation 157/25. It would be Occupational Health and Safety Act. It would be regulation 1101, first aid, as well as I think that's it, yeah. As well as the regulation 21391, construction projects. You also want to make sure that you highlight the importance of early AED use in improving survival outcomes during the cardiac arrest incidents. That's extremely important. You also want to define the scope, make sure that your policy defines where it applies. which project it applies to, under which criteria. These are also sections that you want to explicitly state expectations for compliance with the policy, as well as certain roles, external or internal to your company. Next, you want to look into responsibilities. Typically, again, after assessment of your work-related parties, you want to consider internal and external parties and explicitly state responsibilities related to each of them. Typically, we see constructor and employer. Those are duties of the management and senior management, typically providing AEDs, making sure that trained personnel is provided, maintaining maintenance records, making sure the inspections are done, and so on. Then you want to make sure that supervisory duties are also clearly stated. Those are mostly related to direct enforcement of the policy. Do we actually have processes in place? Do we inspect the AED equipment? Are the provisions of the policy implemented, living and breathing in the field? First aiders and competent people, those are expected to use AED in case of the incident. They're expected to perform equipment inspections, complete the logs, making sure that the equipment is used as prescribed. You have your workers, they're expected to follow procedures, make sure that they report any defects or deficiencies related to emergency equipment. Lastly, external parties, those are your contractors, subcontractors, visitors. They're expected to comply with your site rules. They're expected to provide you proof of training and also participate in any type of training or drills that you might exercise on your sites. This is just a sample. You have to develop responsibility lists specific to your organization. You also want to list responsibilities of people who are going to be responsible for, let's say, replacing the AED or procuring it. So be mindful and look at the organization chart when you're designing this policy. Step 5 is defining equipment requirements for your AED equipment units that you will be procuring. You want to make sure that equipment that you're purchasing and procuring is designed and licensed as a medical device by Health Canada. You also want to make sure you have a process in place to maintain and actually store the documentation that comes with the units. That's also extremely important. You want to list and provide the explicit items that are expected to be found with each AED units, all the accessories required. Those are typically include your CPR mask, scissors, disposable gloves, razor, towels, bags, so on. You want to explicitly provide information on proper storage and protection of the AED units. You want to make sure you specifically provide protection measures for against dust, water, extreme temperatures, UV exposure, and so on. You also want to make sure that all the possible solutions that your company is willing to explore on your workplaces are also listed. Are you going to be providing your sites with enclosures? Are they going to be equipped with alarms? Are they going to be lockable? Are they going to be non-lockable? Is there going to be any type of weather regulation, such as heater within the enclosure to make sure that the unit is maintained at the temperature specified by manufacturer? In order to do so, of course, you need to reference the manufacturer recommendations and manuals that come with the units. Next step is to determine provisions for AED placement, its accessibility, and quantity of AED units that are required for each workplace. Here, you need to list factors that your team will have to consider before you make a decision on where they're going to be placed, how many AED units are going to be there, and how they're going to be accessed. First and foremost, every AED unit that you provide has to be accessible, non-obstructed, and visually marked. So just like in the case of first aid kit, same applies for AED. You also want to consider the time of retrieval of the AED unit. So you want to make sure that it's reasonable. The best practice that you want to go for is a minute and a half, 90 seconds to retrieve AED.
I'm just going to jump in here real quick, Dan.
Yeah.
We cannot stress enough, folks, that time is of the essence. For any of you guys that have taken first aid, CPR, you know that anything beyond 5 minutes, recovery time for life, goes down dramatically. So, whatever your plan is, whatever you're considering, everything that's determined in your evaluation has to revolve around anything, hopefully less than 5 minutes, with about 1.5 to 2 minutes being optimal. So please just keep that in mind.
Thank you, Steve. And this is why we need to be mindful of number of AEDs that we provide to sites to make sure that those factors are maintained. Time of retrieval, any barriers that could be in place, they need to be considered when you're determining the number of AEDs that you provide. So if you have a multi-phase or multi-block project, for example, or multi-tower project, it's not going to be reasonable to retrieve AED from tower A and bring you to tower B, let's say rooftop. It's not going to happen within a minute and a half. So that's why you have to be reasonable and consider those factors. You always want to consult your manufacturer recommendations when you're making this assessments. They provide essential information and provide limitations of each equipment. Once you determined all those factors, in your policy, you also want to make sure that you provide your team with instruction to make sure that AEDs are marked on the emergency plan of your workplace. So you want to make sure, just like any other emergency response equipment, on the project map and the site map, you provide those locations of AEDs, where they could be found and how people can retrieve it. This information is then used for company orientations, project-specific orientations, so the workers maintain awareness of where to gain the access to this equipment. Next, you want to define the training requirements for AED response. Very important, you want to make sure that every time you provide AED to the project, there is somebody who is trained in how to use this AED equipment. Very importantly, also in your policy, you need to specify what are the training parameters that manifest the competency of the worker who's going to be using AED. So you need to consider things like first aid training with AED components, with a hands-on AED component with it. You want to make sure that your team is trained specifically on making a model and the manufacturer recommendation specific to the unit that you procured. That's also extremely important. You also want to make sure that your team is trained specifically for the site response, how long it takes them to get the AED. So those are your drills and site-specific training. Then it's very important in your policy you mention what is the acceptable ratio of trained workers for AED use versus total workers on site. On the larger sites, when you have 200 plus workers, it might not be reasonable to have only one trained individual, especially given that there's going to be a shift work and there's also other limitations that might apply. So in order to make sure that you have not just AED, but also a competent person who can apply it and use it within reasonable time frame, to Steve's point, within under 5 minutes, that becomes a challenge. It is also important that you implement ongoing evaluation of training component of your policy. So your policy needs to specify at what frequency and how you're going to be actually evaluating the competency of your team. How often are you gonna complete those drills? How often are you gonna do evaluations? It is also extremely important that your policy prescribes steps for AED inspection and maintenance provisions. These need to be aligned with your manufacturer recommendations. Extremely important to do so. It is beneficial if you align those processes with the existing process that you have within your organization. So any first aid inspections and maintenances, that might simplify the process for you. It is important to use standardized checklists for it. So you use the same form for all your AEDs, and those are specific to the actual equipment that you use. At minimum, your form should include AED unit ID. You want to have a battery status. You want to have pad expiry dates. You want to make sure that it includes provisions for how it's stored, if there's any damage on it. You also want to make sure that your inspection checklist mentions the last maintenance date, and so on. Your policy needs to explicitly mention frequency of the inspection and maintenance of your equipment. It is important that you establish ongoing provisions for oversight and records keeping. So you want to make sure that all the records related to AED are properly and adequately stored and maintained. Inspection records for AED needs to be stored with that equipment and is readily accessible to workers. You also need to ensure that all the steps related to decommissioning of any defective or deployed equipment is also specified within the policy. So what do we actually do if we have damaged AED? Who's responsible for replacing it? Who is going to be responsible for tagging it, locking it out, making it accessible, requesting a new piece? Those are items specific to your organization, and that's why it's extremely important you develop it specific to how you do things within your company. Step 9 is to develop or at least make sure that there's a provision for site-specific emergency response procedures. So every time that you develop your plans, AED provisions are also incorporated in your site-specific workplace safety plans. You want to mention in those specific roles, communication procedures, and any type of consideration specific to the workplace. You also want to specify in a policy that any incident that is related to AED unit must be reportable. Whether it's cardiac incident where it's deployed or whether it's incident of, let's say, vandalism or theft, you want to make sure that your management is aware of it because either way, now you have a site without a functioning AED unit. In this case, you want to make sure that your team is using standardized report form that mentions key information such as details of the incident, time and place. If it was a deployment incident, that you want to make sure that it specifies where the incident happened, as well as the nature of the first aid that was provided to the casualty. As mentioned before, you can cross-reference the steps that are required to make sure that deployed equipment or somehow equipment that's been in use is decommissioned, tagged, and replaced. You can cross-reference it with the steps that you already specified, or you can mention it here. Step 10 is establishing records keeping and document control. You do want to align this policy with existing provisions that you have. That includes how you produce documents, how you identify them, how do you go through the cycling of the records keeping approval processes. And you do want to make sure that within your policy, you also list documents and records that are stemming out of this policy. So you want to make sure that you mention that this policy is also related to your joint health and safety committee meetings that are related to AED policy development, your inspection records and forms, your training records related to the policy, and so on. You also want to make sure that your policy and procedures that support it include provisions related to how the record is going to be retained, stored, and managed by your company. We suggest retaining any type of record that is related to AED equipment for at least 3 years, unless specified otherwise. You also want to make sure that your policy specifies any type of security provisions related to record control, who's going to have access to the documents, who's going to grant the access, and so on. Lastly, but very importantly, in the document control section, you want to explicitly state how often the policy will be reviewed, who is going to be executing it from the senior management, and how you're going to be obtaining feedback from your workers representative, whether you're going to be done through the Joint Health Committee, whether it's going to be done through your safety reps, depending on the size of the organization and how specific the policy is, whether it's going to be issued to the workplace or the corporately. Enforcement and evaluation. It is extremely important that also within your policy you have provisions for this because we need to know how effective our policy is, and without a proper auditing evaluation, we wouldn't know that. So you want to explicitly mention steps of how this policy will be monitored by your team, who's going to be responsible for it, and so on. How it's going to be done, through which processes. You also want to mention specifically how you're going to be tackling non-compliances and deficiencies. What's going to constitute disciplinary action or retraining, and so on. In this section, you want to also specifically state that any type of tampering with disabling or obstruction of AED equipment will lead to disciplinary actions. You also want to make sure that your supervisor is aware of additional accountability that will come with AED units on site and this legislation, because they are shared responsibilities with the management on site. A lot of times there's additional accountability falls on supervisors. To make sure they're aware of that, we need to make sure it's communicated to them. And they need to understand there's um, additional duties related to making sure that they're enforce the policy, making sure that AED is available, and we fully in compliance with internal requirements, but also as a regulation. Auditing steps, how the policy will be auditing, the frequency of your audits, what criteria will be used, and how your auditing will tie to management review process is also need to be specified within the policy. Without that, it's going to be extremely challenging to maintain process of continual improvement within the organization. So you need to specify how all the identified deficiencies will be tracked, closed out, and actually tracked down to make sure that reoccurrence is minimized. Towards the completion of the process, or once you get closer to the end of developing your policy as a whole, you want to think of appendices that will supplement and support the policy once it's finalized. In here, you're free to decide and free to choose what you want to use and what items will be more relevant to your organization. What we usually see and suggest is inspection checklist to go into the appendices, is your emergency response flow charts related to AD deployment. It's the equipment inventory asset list templates. It could be your training record template for internal training programs, as well as the sample of the workplace plan that clearly identifies locations of AED equipment. Once it's all together, lastly, we want to talk about some related to rolling out of the procedure or a policy rather, sorry. So once it's all developed and you're happy with the draft, you want to gain the formal approval from your senior management, as well as worker representatives from Joint Holistic Committee or the assigned representatives from the field. You want to make sure that you procure AEDs as per your policy within the criteria that you defined. Then you want to make sure that those AEDs are installed in designated workplaces. I want to mention that although we right now more concentrate on the projects, within your organizations, you don't have to limit yourself to it. So feel free to install those in your offices as well, especially those that have more people, your yards. As to Steve's point, we unfortunately see more and more incidents happening, so this extra steps is not going to hurt. So you're going to install the units, make sure that they're visible, non-obstructed, and signs are installed as prescribed. Next, you want to make sure that you also update your workplace maps, identify AEDs, train workers on their locations, incorporate this information in the site-specific orientations, as well as toolbox talks and any meetings related to journalistic committee, as well as review of safety on site. Then, as a next step, you want to initiate workplace inspections targeting AED requirements to make sure that our policy and associated procedures are actually living and breathing within the organization and implemented as expected. The next step to verify that is to conduct mock emergency drills to see how the training is actually effective, if it sinks in properly, if we accommodated and accounted for every item that should be assessed. After we do complete the mock emergency response drill, we do want to make sure that we discuss with the workers any feedback that they have for us. Because it's extremely important to hear from people in the field what the actual feedback is, how they actually seen this process, and if there's anything that they would like to add or correct to make sure that it's more effective and works better for them. Lastly, we want to make sure that we start auditing cycle for the identified deficiencies, we correct them, we fix them, we track them down and make sure that they don't recur within the organization. And that's how we use the typically model of plan, do, check, act to make sure that this policy is continually improved within the company. That's pretty much sums it up. If you have any questions, I'm pretty sure we have some time to answer them right now. Also, you have our contact information here as well. Feel free to email or call both of us, and we'll be happy to expedite the actual further process of implementation or developing the policy, as well as any other questions you might have related to the subject or any other safety needs.
Perfect. Thank you very much, Daniel and Steve,
Thanks,
for that
Andrew.
wonderful presentation. You guys have done a great job outlining all the changes and as well as helping all of our members create their own policy moving forward, which is definitely very important. So we do have some questions here for you. So the first one is, what factors should we consider when completing hazard and risk assessment?
Like we mentioned before in the slide with the step 2, if you don't mind, I'll come back to it so it's a little bit easier to expedite.
Sounds good.
So first and foremost, you want to actually discuss with your team demographics, workforce that's going to be used. You also want to discuss the actual task and nature of the task that will be used. What level of physical exertion is expected from the team? You also want to make sure the environmental factors are also discussed, whether it's going to be extreme cold or extreme heat. If it's summertime, you also consider any process of acclimatization for the workers as well. So this is why it's a multitude of factors that need to be incorporated. You also want to make sure that, as we mentioned, the site layout is also discussed. Accessibility of the equipment, just because we have equipment on site, it does not mean that it can be readily accessible in every work zone. So in order to be diligent, we need to make sure that every work zone, like we said, has an AED accessible within this 1.5 minutes. So to get it there and back, you should be under 3 minutes. That's a big factor
Yeah,
for this as well.
through a learning process, I'll bring up an example of factors that need to be addressed. In the one circumstance that we had to deal with, if you've got your AED locked up in a trailer and it's after hours work, that's going to be an issue. If you've got your AED in the trailer or it's open and your building is 60 stories tall and it's going to take, I don't know how quick the elevators are these days, but it's going to take at least 5 minutes to get down and 5 minutes back up, that's something needs to be addressed. If the same circumstance is evolving and you've got an AED, we've considered many factors and many tried to figure out a lot of solutions for this. And it's not a simple one, especially during the winter time. You would say, okay, let's just throw an AED, let's lock it in the elevator. So our man material hoist, so that if there's an emergency response needed, we can get the elevator up with the AED as quick as possible, probably within 5 minutes. Issue is during wintertime, battery life on those AEDs in the extreme cold are not going to be there. So there are opportunities there. We're handing off an AED to after hours work with a sign off form saying they're going to take control of the AED after hours work. So there's a plenitude of solutions for this, but they all must be considered to get your response time under 5 minutes. And again, cannot reiterate how important that is when you're going through these risk factors.
No, and I think we have a lot of discussions around subtrades being on site later in the day. Other workers have left, the trailer's locked, so obviously they still need access. So I think that's a great point to bring up.
Correct. Yeah.
I will move on to the next question. So how many AEDs do we need on a typical residential site?
Well, that's kind of the follow up on points that Steve just made. There's no right answer. If you have a smaller project and you can retrieve the AED within a reasonable time frame, you might get away with one, and it's going to be more than enough. If you have a project that has several buildings and there's a substantial distance between two, and a site office, let's say where AED location is in one tower, and um, the unfortunate incident happens in the other tower, that makes absolutely no practical benefit for us to have AED, unfortunately, because in this case, by the time we retrieve it, bring it to the casualty, it's not going to do any good. So we need to consider factors like there's no one blanket answer for this. Unfortunately, at minimum one, I can tell you what minimum would stay, but maximum, it really depends on the magnitude of the project, number of people at the project, as well as the sheer size of it too. So you know that some of the multi-phase and multi block projects have their own internal traffic control plan that requires a couple of minutes to go from one side to another, and those things need to be addressed. On typical project, I would say two AEDs on typical tower project should be substantial if you locate them strategically. So if you relocate them and you reassess the locations and you place them strategically within the vicinity of active work zones, I believe that two would do in the most of the buildings. But again, it should be done only based on a rigorous hazard assessment, as well as the assessment of both site layout and duration of the project, number of people.
And then what needs to be considered as a risk factor is inevitably, and we've all been doing this a long time, and I'm sure that all the attendees here would consider this, that these are not inexpensive pieces of equipment, and they may have legs that could easily walk off the site. So we've discussed that at length too, about locking them up. So that has to be obviously that thought process has to be clearly thought out if you're going to have an AED on site that's far away from the head office, but locked up, but with no access.
Yeah, and I do think the legislation right now does just require one AED on site. However, obviously, when assessing your job site needs, I think everything you guys just said is definitely needed. And based on the project, you might need more than one for sure.
Just jumping in on the theft issue. So we worked very closely with the unions on this, and I understand the practical reality of site and why security is an issue. They're very willing to kind of get involved in this. And so if anybody does have a theft issue, let me know because I'm going to talk from the business manager on down. And some things in construction need to be sacred, and I think this is one of them. And so, like, this is there to save, everybody, but the vast majority on people like our sites are union members. And so, like, this is going to be a big issue. If somebody starts stealing these, I mean, I won't sugarcoat it. Like, let us know. We're going to raise this right to the top of the union, and they're going to support us. And so, it's one of those things we'll have to figure out as we go. But, I'm very optimistic that this is something that we can solve. And these machines are going to be viewed as kind of sacred on site, and it won't be part of that same security theft issue. So, but please, if something happens, let us know.
So we do have another question that just came in, and I know Andrew might have something to add to this one as well. Do you have a recommendation for a preferred AED device? You mentioned that training should be specific to the unit purchased. My understanding is that the union has offered to provide training, but will it be specific to our unit?
Yeah, so there's lots of great places to do training. The union does provide, like 183 does provide a lot of health and safety training. I don't think it's a secret. Heathwood is a member. They created the Mikey network. They've been doing it for over 25 years and they've put more units on more sites. They don't have a specific arrangement with any one supplier, but they have an arrangement with lots of suppliers and they also help with the implementation. So, I mean, they're a member. We work with them closely. I'll be fully transparent, but for me, they are like I would call them, right? You want to talk policy, you want to talk safety, talk to Steve and Daniel. You want to talk about getting a unit on your site, talk to Chuck and talk to the Mikey network. So that's our biased, but transparent recommendation. So
Perfect. And then the next question is, who is responsible for AEDs on a residential construction project?
A constructor. That would be not an employer, would be explicitly mentioned in the regulation, that would be a constructor. So whoever takes the responsibility of a constructor at the time would be responsible. It's extremely important to you also for the construction managers to clearly define those roles. Sometimes we have some of the contractors temporarily hold NOP and act as a constructor during, let's say, demolition stages or excavation stages, early excavation, exploration stages. It's extremely important to have this understanding and act as a team, because a lot of times those companies are not fully understand the full responsibility of a constructor, and they might not understand the depth of responsibilities that they overtake. So please inform them, let them know, and equip them with at least knowledge of what needs to be in place to make sure they're in compliance as well. So especially now, as this is a new legislation, I think it's extremely important we within the industry work as a team and spread this awareness and support each other, making sure that everyone has this understanding of what's required and what's the minimum standard. So yeah, it's a constructor, and like I said, luckily for now, legislation states not an employer, just a constructor.
Perfect. And then actually, we have another question. Who is responsible for the maintenance of the AED device? Is it an outside source?
So typically, these pieces of equipment are maintained, yes, by external parties who are trained and competent to do so. I would strongly encourage contacting manufacturer for it. Their manuals explicitly specify the frequency and maintenance as well as the steps that constitute the maintenance. And they're responsible typically for getting them back, assessing, testing, and sending back to the customer. Just similar with the fire extinguishers, annual maintenance, you want to make sure that there's a competent person who will do all the testing and then send the unit back. Same with AEDs. Review your manufacturer recommendations, make sure they're consistent with those, and typically those are manufacturers who do maintain them.
Perfect. So I think that is all of the questions we have today. I don't know if there's anything you two want to leave with the audience.
No, I think we've got that pretty much wrapped up.
Perfect. Well, thank you very much for all of your help on this and this great presentation. It's been great working with you both on the policy guide, and we'll definitely be sending that out after as well. So I will pass it over to Yasmin for some closing remarks, but thank you again.
Thank you.
Our pleasure. Thank you, Meredith.
Thank you, Meredith. So just as we wrap up today's webinar, I want to thank again Steve and Daniel for being a part of this and creating this best practice guide. This will be extremely helpful for our members as well as us as they start putting together their own AED policies. And as noted today, like no site is the same. Each company and site has different requirements and will require different policies. So just today in this discussion, reinforce that AEDs are part of a broader response system, and a strong AED policy specific to your organization helps ensure devices are accessible, well maintained, and supported by trained workers. And this provides clarity, consistency, and confidence in these high stress situations where AEDs will be required. So thank you again to everyone who joined today. If you do have any other questions, please feel free to reach out to us at RESCON or Steve and Daniel at Smart Safety. We will be including their contact information as well as the slide deck and the recording of this webinar that will be sent out in the post-event summary. So thank you guys once again for being here and creating this guide for us today, as well as everyone who's been involved in this process. And together, by prioritizing preparedness and prevention, we can continue to make work sites safer for everybody. So thank you all.
Thank you.
Thanks, everyone.